Hello, welcome to Trinity Medical Center. You requested a pre-op visit? Okay, no, that's totally fine to be nervous and to want extra information. We want you to be as comfortable as possible in our facility. So, what we're going to do is I have your prescriptions. We're going to go over those side effects. Who's going to take you home after your procedure? What to expect, some emails and phone numbers you may need after. So I've got your file ready. We will be taking this home after. This is yours to keep. It has discharge instructions as well as your medication, side effects, and other information. So we're going to fill out a few forms and go over your medication, okay? So I've also prepared a bit of some recovery vitamins for you based on what you'll be having done, and I'll guide you on how to take those properly. So we're going to fill out your form first, and I'm going to put it in our system, okay? Great. So we need to know who's going to be taking you home after your surgery. Okay, what's your relation to this person? Okay, great. And where will you be going? To their home. May I have that address? Is there an apartment or suite number? No? Okay, cool. Now, we're gonna have you come in and get prepped at 6 o'clock in the morning, and we're going to, of course, be the anesthesiologist, and you'll be in a room for a bit by yourself where they're going to give your IV, and we're going to put some special socks on you to keep you warm and to keep the circulation going. And you're welcome to take those home. A lot of people like those. Now, I want you to be escorted out on a wheelchair, so make sure your nurse knows that. I will notify her, and I'm going to give you Percocet for pain afterwards, okay? I want you to take this every 4 hours in the beginning, and then as needed. And that is for pain, okay? Alright, put your prescription in. So, with your Percocet, I want to go over some side effects with you so you know what you're getting into. Now, this medication is for pain. It's not for recreational use. You might experience dizziness, stomach upset, nausea, vomiting, constipation, drowsiness, and some itching. You may develop some red splotchy spots, okay? Now, I don't want you to operate any heavy machinery when you're on this medication. It means no driving or anything of that nature, okay? Now, I'm going to write down the name on this paper. And there are no notes except how to take it. And I'm going to put this in your file, okay, for you to take home. And that will be with your medication as well. Now back to your file. You'll also be taking another medication. It's an antibiotic though, and I'll go over that in a minute. Now, you want to report anything to your nurse, such as fever, pain, or some drainage. There will be some blood but if it needs to be bright red, okay? If you see that, don't be alarmed. And I will be coming over bedside manner to check on you, but most of your care afterwards will be done by our nurses, who are highly qualified and trained. Now, we do provide some facilities afterwards if you wanted to stay, but you have said you're going with your family members. Okay. Now, do you have any dietary restrictions? No. Yeah, sometimes we have gluten-free, vegetarian. We like to, cater to those needs. Okay, so we got that. Now, we're going to go over some immunization. Have you had your influenza immunization? Yes? Okay. Great. We've got this one done. Oh, and I also need verification on your date of birth. Great. Now, you will have a nurse sign you out. They will tell you when to leave and they'll escort you. They will also pack your belongings because you will be sore. Now, for the first 24 hours, no alcohol, okay? Don't be partying. And I want you to begin with a liquid diet. Then we can go on to light foods, jello, soups, something easy on the stomach and soft, mashed potatoes, things of that nature. Then you're gonna progress to your normal diet if you don't feel some sort of nausea. I want you to take your prescription as directed, okay? That's very important for recovery and healing time. And if your pain persists with the painkillers I give you, I want you to call me. I will have my email and my for the office, so you can reach us during office times. If it's later, I will give you my phone number, which is also on the card. Okay? For activity afterwards, I don't want you doing anything vigorous. No hard exercise. Just take it easy for a couple of days. And don't try to do legal documents or sign serious documents. Within 24 hours, you will be on medication and not in the best judgment. No bending, lifting, or straining, okay? Now for your wound care, we're gonna have a small dressing. It's not gonna be anything severe, and I want you to keep that on. And it shouldn't get too messy, but I'm gonna give you extra gauze and tape and pads in case you need them. Okay, and you're gonna want to sleep with 2 pillows, okay? So I'm gonna request that in on your file. And you might get cold, so we're gonna have a heated bed for you. It's like a bit of a vest you put on, and it heats up with warm air. Because your body temperature will drop, and that is totally normal. And follow-up care, you will meet with me in my office each week. We're going to check up and make sure everything is going as planned. Now, I want you to contact me immediately if you notice some of these signs. Do not wait. So, inability to void within 4 hours after discharge, heavy bleeding or some discharge from your surgical scar. Now, fever of 100 degrees or greater, that is a cause for concern. Severe pain or excessive bruising, swelling, or redness where we performed the surgery. With this surgery, there should be minimum bruising, a bit of swelling, and very minimum redness as well. So I'll have your nurse sign your discharge papers when that goes to happen, and you will sign it as well before the surgery, and your caretaker will after. Now, go over some more of these. We have our booklet for our medical center here, talking about our hourly rounds and what we do. We have the contact numbers on the back for you as well. Now, the hourly rounding schedule is 6 a.m. to 10 p.m. and that's rounding every hour. And then there's 10 p.m. to 6 a.m. and that's rounding every 2 hours. And what they will do is check your well-being, see if you want or need anything, temperatures of the room, anything of that nature, monitor your comfort and assess your pain, help you move, go to the bathroom, change positions, and things like that, just to be your caretaker. They're going to make sure you have access to the following amenities that we provide. We can also get you an extra heater for bedside if you do get cold, but you will be having access to a telephone, a bedside table, water, some other beverages. I'm going to want you on a clear beverage. You're allowed ice, and later on some crackers, then breakfast in the morning. But the day of, I don't want anything in your stomach, okay? Or you're going to have a call light for assistance. It's going to be on you, and you will just press it if you need help, okay? And I don't want you to be shy to use that. So that is for you to use. Urinal and or bedpan. You're going to be able to go to the restroom though, so I don't think you'll be needing that. And a wastebasket. Now, you're going to have your visitor with you the whole time, and we'll provide a cot for them as well, so they can be with you. And you will receive a survey in the mail later to tell us how we did. But if there are any causes for concern right away, let us know immediately if something is bothering you or causing you discomfort. Now we do a pain management scale. It's a bit funny and cute. It's a 0 to 10 scale, and we have faces on there, okay? And 0 is no pain, 1 is, 2 is mild pain, 4 is moderate pain, and of course the odd numbers are just in between those. 6, severe pain, 8, very severe pain, 10 is worst possible pain. And your nurse will come in there and ask you where on the scale you fall so we can give you pain medication, okay? And relieve that pain. Now we're going to want you turning in your bed and walking fairly early. We want to keep you very active and in that sense, not, lifting anything heavy, but moving around, okay? Now, I want you to always speak up, don't be afraid, okay? And I will have your pain medication listed under here as well. That's also in your file to keep. We also value the cleanliness of the facility, and we want you to also rate how clean places, the upkeep, and if any reason your room and bathroom were not always properly kept clean or sanitized, I want you to call this number here, and we were going to listen to your concerns and ensure providing a better and healthy environment for you. Okay, so that'll be there with that phone number. Mine is also on there. Now, here is some discharge process for you. Your nurse will tell you when I have discharged you, and she will roll you out. And there are also notes on here I will continue making patient rounds and complete your paperwork, so when you leave, you'll have said paperwork. I will review your medication and any additional testing that goes on. Check your blood pressure, your glucose levels, and things like that, making sure you're hydrated. Now, when your paperwork is complete, your nurse will review them as well and let you go. And when you're ready to leave, they will figure out your transportation and take you out. And if you would like extra privacy, there is a back door. You can go out instead of the front. Okay, so I'm going to hand you these, and there's a planning for your discharge paper, what to expect, what to bring, things like that. If you have any questions, you can leave them on the back. We have a notes paper, so you can write down your questions so you don't forget them. And if you have children, I don't want you to be lifting them. No children? Okay, good. That'll make it much easier. Now for your other medications, I am prescribing you an antibiotic. It looks like this, and as you can see, the medications are of different servings, basically. And we have the first day, second day, third day, fourth day, fifth day. And the instructions are on the back on how to take them. You will be taking these before breakfast, after lunch, after supper, before bed. It'll tell you when. And here I have the paper describing what medication this is. This is amoxicillin. And I want to warn you of one sign that is normal. Some people do experience depression when on antibiotics. That is totally normal, and you may feel a bit sad after, and that is normal as well. Now, this also may cause dizziness, but so all your painkillers, you want to keep laying down and just take it easy, very easy. It has all these instructions if you need them, and that'll be with the pills. We made sure you're not allergic already, so that's good. Now, I want to recommend these. These are optional. We do team up with Vitamedica, and they do some recovery vitamins, and there's different steps. This is the morning formula. This is bromelain. This is the evening formula. This is arnica, okay? These are itty bitty pills. Each one has different instructions on how to take them. Like the morning formula, you of course would take in the morning, and you would take 3 tablets. And I would recommend taking these with your breakfast or after, and drinking an 8-ounce cup of water with it. And same with the evening formula. I would say do that with dinner or after. And these two, you don't want to make contact with these pills. They're very delicate. And this is to reduce bruising, swelling, and pain from soft tissue injury. You're going to want to pour them into the top and then place them under your tongue and let it melt. And those are about, with these, I'd say 1 a day, sometimes 2, depending on your pain level. And this is anti-inflammatory. So you would take 1 of these with the morning and one with the evening. And this set cost $80. If you would like that, I recommend it. You don't have to get it, but I think it helps in the long run in the process. Want me to add that? Okay, that'll go to your end total, and I'll get that for you. Here's your file, your medications, and your Vitamedica supplies, and I'll send you off with a lollipop because that makes any doctor's visit well worth it. And if you have any more questions, please feel free to ask, and thank you for coming in.